Hello, my name is Kylie Agee. I am the program manager of the Rural Health Initiative at the Mountain Area Health Education Center, or MAHEC, located in Asheville, North Carolina. I am an author on our publication in the Journal of Rural and Remote Health titled Transitioning to Rural Practice Together, a Rural Fellowship Model in 6 Ps. Our research team includes Dr. Benjamin Gilmer, Clinical Director of MAHEC's Rural Health Initiative, Dr. Chase Harless, Research Data Analyst, Lauren White-Gibson, former Rural Health Initiative Program Director, Dr. Jill Fromwick, Research Scientist, Dr. Robin Latessa, former Chief Academic Officer at MAHEC, Dr. Gary Beck-Delahan, Director of Educational Scholarship at UNC Chapel Hill, and Dr. Brian Hodge, Chair of the Department of Community and Public Health at MAHEC. The purpose of this study was to examine the effectiveness and early outcomes of MAHEC's Rural Fellowship Program, which was launched in 2017 in an effort to address the widening healthcare gaps in rural Western North Carolina. The Rural Fellowship is a 12-month post-residency program that aims to enhance the placement of newly graduated providers into rural communities in our region. The fellowship also seeks to ease the transition into practice through continued education and hands-on support, and to ultimately retain the fellows in rural practice long-term. Our key findings in this study include a high success rate in the Rural Fellowship's ability to place and retain providers in rural practice, with a 3-year retention rate of 90% and a 5-year retention rate of 84% for fellows who were in the program between the years of 2017 and 2021. The interviews conducted for this study also highlight the effectiveness of the curricular structure of the fellowship, which are referred to as the 6 Ps. The 6 Ps include placement in a rural community, preceptor development, project work, partnership, the practice of clinical skills, and protected non-clinical time. Not only does the fellowship year support new clinicians transition to rural communities, but it expands their clinical skills and further develops the attitudes that promote resilience and retention. Additionally, this model reveals the vital importance of instilling a deeper connection with the local community that go beyond the walls of traditional clinical practice. The findings of this study imply that programs that provide support and continuing education during the transitional year between clinical training and practice are an effective tool to increase the placement and retention of physicians and other healthcare providers into rural communities of high need. The findings also support the importance of integrating the key elements of MAHEC's Rural Fellowship model, including teaching, peer support, and personal resiliency, to support a vibrant practice and personal meaning in medicine in order to facilitate the beginnings of a strong professional career. While there are early indications that the 6 Ps were effectively delivered and impactful during the fellowship year, limitations do exist based on the length of the study and the sample size. Next steps include additional studies to evaluate long-term retention rates and career satisfaction of former rural fellows in Western North Carolina. Further studies of the program and outcomes over time would also clarify which aspects of the curriculum are the most meaningful and lasting. We also recognize the limitations with a small sample size that is confined to the Western North Carolina region, which limits the generalization of the study's findings. However, the consistency of the qualitative statements from the interview process are consistent with responding to the challenges clearly outlined in existing literature regarding rural practice. These findings suggest promise to extrapolate similar program designs to other areas and at a larger scale over time. Thank you for your interest in our research and in our Rural Fellowship Program. Please feel free to reach out to me, to Dr. Benjamin Gilmer, or to Dr. Brian Hodge if you would like to discuss the design of our program or of our publication.